Hello, I'm Anita Balakrishnan and I'm a member of the EAHPBA Scientific and Research Committee. I'd like to thank you for taking the time to view the results of our EAHPBA survey on the delivery of HPB surgery during the COVID-19 pandemic. The spread of the pandemic caused a significant degree of disruption to the delivery of healthcare around the world. Hospitals struggled to cope with the numbers of patients affected directly by the virus, but also lacked resources to continue to care for patients with other life-threatening conditions such as cancer. Many members of the EAHPBA were keen to understand how other member countries were being affected by the pandemic. This presentation highlights some of the challenges faced across both of these continents in countries with both high and low prevalences of COVID-19. The EAHPBA Scientific and Research Committee designed an online questionnaire exploring some of the key issues faced by HPB units during the pandemic. The questions asked covered the provision of cancer surgery, reasons behind cancellation of operations, and changes to standard treatment pathways for HPB cancers. Surgeons were also asked about preoperative screening and personal protective equipment or PPE availability. The survey was disseminated to all EAHPBA members via email and Twitter to cover a 3-week period between the 10th and 30th of April 2020, and reminders were sent twice weekly. We obtained 145 responses to the survey questionnaire. This covered surgeons across 130 centres and 32 countries. The majority of responses were from France, Spain, Italy and the United Kingdom. This may reflect an increased degree of interest in the survey in these countries due to the relatively high prevalence of and disease burden caused by COVID-19 in the respective units. The majority of responses were from surgeons practicing in academic centres and covered a good range of HPB surgery volumes, as shown by the graph showing the numbers of liver and pancreas resections per unit per year. We wanted to assess the impact of COVID burden on HPB service delivery across countries. To do this, it was necessary to obtain a relatively accurate reflection of COVID-19 case burden in each country, and we therefore used the documented number of cases per country according to the European Centre for Disease Control, or ECDC, website on the 20th of April 2020, the midpoint of the study period. We then arbitrarily grouped the countries into COVID-high countries with over 100,000 cases each. These countries consisted of France, Germany, Italy, Spain and the United Kingdom with a total of 80 responses, and COVID-low countries with less than 100,000 cases and a total of 65 responses. One of our key findings was a large reduction in theatre capacity for HPB surgery during the pandemic. On average, each unit was only able to run 2 operating sessions per week, and more than 60% of respondents reported running less than half their usual numbers of operating sessions. Countries in the COVID high group were particularly affected, with the exception of Germany, who reported operating capacity levels continuing at over 60% normal. ICU capacity was also increased in most hospitals during the pandemic. COVID-high countries reported greater increases in ICU capacity compared to COVID-low countries and had a greater proportion of the ICU capacity used by COVID-positive patients. Another interesting finding from our study was the prevalence of preoperative COVID testing and corresponding PPE use. 36% of respondents stated that preoperative testing was not routinely performed in their units. As expected, this was more prevalent in COVID-low countries. Full PPE in the form of N95 masks and above and eye protection was available in over 80% of respondents' units for COVID-positive cases in the operating theatre. Of note, however, only 40% of respondents had respirator-type masks in the operating theatre when the COVID status of the patient was unknown. This suggests that there was still a large proportion of units that were not complying with guidance from surgical societies regarding PPE use, possibly due to resource limitations and lack of adequate PPE supply. We asked our survey respondents to rank the reasons behind cancellation of HPB surgery in their units. The reasons considered most relevant were lack of ICU beds, national policy, and hospital policy. Some surgeons also listed concerns around patients contracting COVID-19 in the perioperative period as an important reason for cancellation, in keeping with some studies that have been published showing higher morbidity and mortality in such cases. The lack of operating sessions required a rapid change to the standard management protocols for most HPB cancers. In COVID-high countries, many patients with resectable or borderline resectable pancreatic cancer, and especially those with colorectal liver metastases, were diverted to chemotherapy rather than upfront surgery. For cancers where chemotherapy had a less clear evidence base, such as hepatocellular carcinoma, local regional therapies such as embolization and ablation were employed. Patients with cholangiocarcinoma and those for whom chemotherapy or local regional treatments were not an option were listed for surgery to be performed as soon as conditions allowed. In summary, our survey showed some key findings on the impact of COVID-19 on the delivery of HPB surgery across COVID-high and COVID-low countries. We found a dramatic reduction in the amount of HPB cancer surgery performed, particularly in COVID-high countries. Germany was an exception in this group, possibly due to higher than average ICU bed capacity even pre-pandemic. The majority of patients who should have undergone urgent HPB cancer operations were diverted to receive chemotherapy and sometimes local regional treatments. Guidance for PPE availability could not be met in many units, possibly related to lack of resources and PPE supply. Our survey identifies shortfalls and challenges that need to be urgently addressed to allow recovery of HPB cancer surgery and appropriate preparation to minimize the impact of any further COVID-19 surges in the future. Thank you.